Welcome. You're listening to Ask the Doulas, a podcast where we talk to experts from all over the country about topics related to pregnancy, birth, postpartum, and early parenting. Let's chat.
Hello. This is Kristin Revere with Ask the Doulas, and I am thrilled to chat about tongue function and why it matters for infants with Kaili Ets of Kaili Ets Family Wellness. She is a seasoned pediatric occupational therapist, infant craniosacral therapist, a holistic sleep and reflux specialist who has also done extensive training in tongue ties. Kaili is also a mama of two. She's lovingly called the holistic baby guru and is known for handling the more complex cases and really diving deep into the root cause when she supports her clients, whether it's body tightness, compression, reflux, tongue dysfunction, or possible tongue ties, sensory processing differences, and reflex issues. And she is obviously the guru with all of her extensive trainings and her specialties. So she is here to simplify your search, answer questions, and take you on a journey to understanding not only your baby and child, but also yourself on a whole new level and help you both thrive. Welcome, Kaili.
Thank you so much for having me. I'm so excited to be here, and I can't wait to chat about this topic that I'm super passionate about.
Yes, and as birth and postpartum doulas, and with a team of lactation consultants as well, we do run into a lot of questions from families about tongue function. So I'm thrilled to have your expertise in this discussion and how it may not always be a tie, because I feel like now with education and information compared to when I started as a doula 12 years ago, everything almost goes to that assumption of, oh, it's a tie. It's a lip tie or tongue tie, but I'd love to hear your thoughts on it.
Yeah, so, and this is the thing, right? Is I feel like tongue ties are like the new trend going on right now. But the more you learn about it, the more you start to realize that it's not always just a tongue tie. And this is why I have a lot of clients who will go and get like a tongue tie release and nothing changes. And then they're even more frustrated. So I kind of want to maybe start a little bit from the basics of like, why are we even worried about the tongue? And the tongue is such a key player in feeding, breathing, swallowing, digestion, speech, overall posture, and even sleep. And so when a baby struggles with any of these, especially when we see early like feeding difficulties, whether it's at the breast or the bottle, or maybe a little bit later on with intro to solids, it's easy to assume that like the tongue tie is to blame. In reality, tongue dysfunction can happen for so many different reasons. And so a restriction of the frenulum, so the frenulum is that little quote unquote string of fascia under the tongue, that can limit mobility. It can also, other factors can limit the poor tongue function. So like it could be because of a too short or too tight or too thick frenulum under the tongue, or one that's way too far forward and it's affecting the ability of the tongue to make all of the movements. But here's the thing. Body tightness or fascial restrictions. So fascia is a connective tissue that is over all of our muscles and organs and nerves and everything in our body. And it's like the white piece on raw chicken that you try to cut off and it's so hard to cut off. That's fascia, and it protects everything underneath, and it's really good at protecting but not so good at releasing. So sometimes it's fascial restrictions, and there's a front line of fascia that connect from the tip of the tongue all the way down the neck, through the kind of diaphragm area, in the stomach, through the hips, all the way down to the tip of our toes. And if there is tension anywhere in the body along that deep frontal line, whether it's from in utero positioning or birth or something like that, can actually restrict how the tongue moves. So it might have nothing to do with the lingual frenulum, which is that little kind of quote unquote string under the tongue. Another thing that can, right? It's like, oh, okay, so this is why if we release quote unquote tongue tie, it doesn't really do anything because the tongue's still not working. Other tightness.
And the tightness could be trauma from birth or
a variety
of issues.
Exactly. And then a kind of the next layer of that is that tongue actually relies, and sometimes it's the tongue that's not working properly. Sometimes it's the cheeks that aren't doing what they should be doing. Sometimes it's the lips that aren't doing what they should be doing. And so it's kind of like all of them work together. But cranial nerve are another really important piece of tongue function. And that's something where people are like, what? But if there's compression, so like if there's any cranial bone kind of molding, you know, from birth or in utero positioning, when babies come out and they often have those like cone-shaped heads, or you've got some overlapping of the different bones in the head, that molding, that cranial molding, if it doesn't kind of come back into like that nice round shape, even like flathead syndrome can also affect cranial nerves. It compresses the nerves because there's a lot of nerves that come through the back of the cranial bones. And if those get compressed or squished, then the nerves are going to get compressed, and then the nerves are not doing what they need to do in order to make the tongue work properly. And so it could be because of the bones in the head. It could also be because of tight jaws or recessed jaw, which often a lot of babies have. And so that's again putting pressure on those nerves, meaning that then those muscles are not working the way they need to work. And the other piece is that when the tongue is restricted, babies often, and like, so by restricted, I mean it's not working well, it's not doing what it should be doing. Babies often also develop habits like clenching their jaw. Maybe they're doing something weird with their lips to like purse their lips, or they start chomping because they're not actually using their tongue properly, but they have to figure out another way to get the milk out, right? And so they then develop all these compensatory patterns, which then just makes everything even harder also. So really, this is why like tongue tie releases are sometimes they're very necessary. They're really like one piece of the larger puzzle. And so this is why we really need to understand more of like what is a tongue tie, what is not a tongue tie, what else could be affecting the tongue function, because it's not always a tie. Yeah. And so I don't know
Obviously,
if you,
from everything you explained, there are so many other conditions, and we have a craniosacral therapist in the area that does a lot of infant work, and it's amazing to see the difference in everything from sleep to temperament to reflux, certainly.
oh my gosh, and don't even get me started on all of that, because reflux really is like increased air intake is one of the main causes of reflux. Why are babies getting air while they're feeding? Probably because their tongue is not working properly. Maybe that's because of a tongue tie, but maybe it's because of something else. Body tightness is a huge piece of the puzzle, and that's often something that gets overlooked in tongue tie releases, because pediatricians, like dentists, they're not really like thinking about body work, be honest
Right.
here. Some of them know about it, but some of them really don't. And some of them are all about like, your baby has a tongue tie, let's do the release and you're good to go. And you're like, no, you're not good to go. There's so much more involved. But even when you have a tongue tie release, or when you release the tightness, for example, that might be causing that tongue dysfunction, fine, then you have a tongue that works better and has more range of motion. But guess what? That tongue still doesn't know what it needs to do. We still then need to strengthen the tongue in all of the different ways that it should be working and moving. So, for example, really important, lots of families I work with, their doctor will be like, oh, no, your baby can stick their tongue out. It's not a tongue tie, or like their tongue is fine. And you're like, okay, but sticking your tongue out is not actually what we need for good, efficient feeding. We need that tongue to be cupping around the nipple of the breast or the bottle. We need that tongue to be elevating up to the palate. We need that tongue to be doing that peristaltic kind of wave-like motion in order to really efficiently create that vacuum seal and extract the milk. And all of those pieces are reliant on the tongue having that range of motion, but also that tongue being strong enough in all of those different movements to be able to feed efficiently. And what happens is when we have a restricted tongue, so whether it's because of a tongue tie, whether it's because of body tightness, and that often happens in utero, the baby has had many months of not using this tongue properly to swallow in utero, and then they come out and they're born, and they're using all of the same compensatory patterns that they were using in utero. And now we have this baby who has tongue dysfunction and has no clue how to use their tongue properly. And when we release that tongue, let's say it really is a tongue tie because of a frenulum that's too tight or too short or too thick or too far forward, the doctor or dentist releases that. There's more range of motion, but that tongue still needs to be like rehabbed or retrained on how to work properly. A knee surgery, you don't just expect that, like, oh yeah, you had your surgery, we put the like whatever the knee orthotic or prosthetic in place or whatever it is, and now you're good to go. No, you get sent to like many weeks of physical therapy to like strengthen the knee and get it working properly and get the muscles be really doing what they need to be doing, and stretching things that are tight and strengthening things that are not strong enough. It's the same thing with tongue is also a muscle, but actually the tongue is 8 different muscles, and we need to strengthen all of those muscles and teach them we want those muscles to actually do. And that's a big missing piece in this whole kind of tongue tie world that we have right now, where families will go and they'll get an assessment and the dentist will be like, yep, there's a tongue tie. Okay, let's release it today. And because families don't know any better, they think that this is like the magic pill. It's going to solve all their problems. They get the tongue tie release. They do their wound care stretches, and then that's it. And their issues still don't get resolved. Maybe some things improve a little bit. Overall, they're like, what is going on? Why didn't that work? And that's because we have to retrain the tongue. We have to do some oral motor therapy to get everything working properly. And that's really kind of something that I support with, but it's something that I feel like dentists and pediatricians just don't quite get.
That makes sense. And my son actually had a tongue tie, and there weren't a lot of pediatric dentists in my area who offered laser at the time. So I went to a doctor, and it luckily worked. We had exercises that seemed to be more than basic wound care, but I was struggling with that clicking sound during breastfeeding pain, and my children are 21 months apart. So I knew that that wasn't normal. And at the first pediatrician appointment, she had recognized that there was a tongue tie. So we acted quickly, and then by following the exercises, it worked, but it sounds like that isn't something that's standard care.
Right. I think that we're moving in that direction more so. I think there's still a lot of pediatricians and a lot of like pediatric dentists who don't really understand that the tongue tie release is just one piece of the puzzle. So I think that you really lucked out. That sounds great. That's exactly what we ideally want. Ideally, you want a provider who, first of all, is going to do like a comprehensive assessment of what that tongue is actually doing. And looking inside the mouth or looking to see that the tongue is sticking out is not a comprehensive assessment to see what the function of the tongue is, because that's really what we care about, is the function of the tongue. You can have tightness in the tongue and that tongue is still doing what it should be doing, in which case the tongue tie release is not needed at that moment. We really want to look at the function and not just the structure or like what it looks like. And so this is why a comprehensive assessment, you really want your provider to like have their finger in your baby's mouth, feeling the tongue and what is it doing? Is it moving? How is it moving? Is it cupping? Is it moving up to the palate? Where is it restricted? Like what's going on inside the mouth? We can't look at that and understand. And I think a big piece too is then that body work, right? Like craniosacral therapy is an amazing piece of the puzzle also for tongue function. And I think that that can really help set up families, if they have access to it, help set up families for potentially a more successful tongue tie release as well, if that is needed. But a lot of the time, like you mentioned before, craniosacral therapy can do a lot of improvements just from a few sessions without ever having to consider the release. And the tongue tie release will only work, quote unquote work, if it's actually the lingual frenulum that's the tight part, too short or too thick, and that's the part that's causing the restriction. If it's these other things that I mentioned earlier, like the body tightness elsewhere in the body or the cranial nerve compression, then the tongue tie release is not going to fix the problem. We're running into, I see both sides of the coin. I see some families who get the release done and they have a similar experience to yours where they had a good provider, it sounds like, and like things are great and they saw a lot of improvements. And then I have the families who didn't know, right? And so they just got a release because their dentist or whoever they went to see said, yep, your baby has a tongue tie. We need a release. Here we go. Let's do it. And they don't see any improvement. Now, the other thing that I see a lot is where families will come in and say, oh, my provider told me that it's nothing to worry about. It's just a mild tongue tie. I hear that all the time. And I'm like, here's the thing. How can it be a mild tongue tie? It's either a tongue tie is there or it's not. Everybody has that lingual frenulum under the tongue. Everybody has it. We need that. And it actually does regrow after you have it released. We just want it to grow in a more flexible, kind of stretchy position. But everybody has it. That's what helps your tongue stay kind of grounded to the floor of the mouth. So it's not like flopping around in your mouth. So we need that for like stability in our mouth. And so this is the other piece where it's like, how do you qualify mild? Like it's either it's causing dysfunction and that frenulum is too tight or too short or too thick or too far forward. And that's the thing that's causing dysfunction. Or it's not causing dysfunction, and then it wouldn't be considered a tongue tie because there's nothing to worry about. Everything is working fine. So that's the other piece of what I see is I see families getting dismissed. And this is the piece too, is like, I wish those doctors or pediatricians who are saying, oh no, it's just a mild tongue tie. What they're actually saying is, I don't see too much tightness in that lingual frenulum, or it's moving well, or it's stretchy, or whatever it is, it's long enough, whatever it is, they have their own kind of assessment for the actual lingual frenulum. But what they're missing is, okay, that tongue is still not working well, and they're missing the piece of why else would it not be working well?
That makes sense. And as you mentioned before, they may not have enough awareness to refer a craniosacral therapist or other specialist, or it's just, I guess, an easier fix to go the route of it's either a tongue tie or it's not and move on. So, and of course, we're limited in time with our medical professionals. And so they may even have awareness and referral sources, but things are stretched. So I love that you're educating not only on your own podcast, but podcasts like Ask the Doulas, so families can advocate for themselves and understand all of their options when it comes to tongue function and anything from sleep issues to colic to feeding issues like I experience with pain and breastfeeding.
Hey, Alyssa here. I'm just popping in to tell you about our course called Becoming. Becoming a Mother is your guide to a confident pregnancy and birth, all in a convenient 6-week online program. From birth plans to sleep training and everything in between, you'll gain the confidence and skills you need for a smooth transition to motherhood. Live coaching calls with me and Kristin, tons of expert videos including chiropractic care, pelvic floor physical therapy, mental health experts, breastfeeding, and so much more. You'll also get a private Facebook community with other mothers going through this at the same time as you to offer support and encouragement when you need it most. If you'd like to learn more about the course, you can email us at info@goldcoastdoulas.com or check it out at thebecomingcourse.com. We would love to see you there. We also have a book called Supported, Your Guide to Birth and Baby, which makes a beautiful companion to this course. It's a great book for any expecting mother and is the perfect baby shower gift. You can find information on that book at supportedbook.com.
Exactly. And I think the other piece that's important to know is that not like tongue ties and tongue function is not taught in regular curriculum for pediatricians, for pediatric dentists, but even for lactation consultants, for occupational therapists, speech language pathologists, physical therapists, whatever. It's not taught in the standard like school curriculum to become a doctor, a dentist, an occupational therapist. Really, this tongue function piece and this tongue tie piece is separate professional development that you have to do on your own because you're passionate about it. And this is where, unfortunately, I feel like doctors, at least here, I'm in Canada, so the doctors, like I hear all the time that they dismiss families for a variety of reasons because they just don't know, but they're not like they're not kind of admitting to the fact, well, I don't know, maybe you should go and see XYZ person, right? They're not making that appropriate referral. But this is
Right.
also why sometimes you hear like your provider might be like, tongue ties aren't actually a thing, that's just a fad, right?
Yes.
Or they'll outgrow it, don't worry. Or for lip ties, oh, don't worry, eventually your toddler is going to fall and that lip tie is going to get cut on it. And you're like, oh my gosh, this is like not what we should be telling families because
No.
that's really not helping the situation in that moment.
Right. And it can
So,
affect speech later. I mean, there's
so
so many
much.
issues.
So many issues. The thing also with the tongue and the tongue function is that we want to remember that our optimal resting posture for good airway, kind of openness and patency, breathing, and just kind of like all of that airway stuff, but also dental, like arches and development and palate and all of that. Having our tongue up to the palate, resting just behind our top gum line, our gums or teeth slightly apart, and our lip closed. The amount of babies that I see these days that have their like mouths hanging open and drooling all over the place and not feeding well because they've got like all the milk spilling out because their lips aren't working, their tongue isn't working. There's just so much going on, I feel like, with our babies in terms of tongue function, but also just overall body function. But that is our optimal resting position. And having that mouth closed and that tongue up to the palate is what is going to help develop our palate. It's going to help with our breathing and eventually our sleeping as a result. If we're mouth breathing during sleeping, we're not getting into a deep sleep. There's so many different things. If we're mouth breathing, we're more chest breathers instead of deep belly breathers, which means that we're also going to be more in a heightened state of arousal, like that sympathetic arousal state, which means that we're going to be more sensitive and potentially more like higher needs temperament kind of, and more fussy and prone to going from 0 to 60.
You mentioned the tightness, and there's so many things to look for. So it sounds like seeing a craniosacral therapist, addressing any concerns with the tongue, and then certainly doing exercises and stretches and so on, and making sure that tongue placement is correct. Because, yeah, there are so many issues with mouth breathing, and we, with sleep consultants and overnight doulas address a lot of the sleep concerns, and we are referring to craniosacral therapists and certainly infant massage therapists. And there are so many different treatments beyond seeing a pediatric chiropractor, for example, to recommend.
Yeah, exactly. And there's so many symptoms that you can like see. I don't know if you want me to go through some of the signs that might indicate that there's tongue dysfunction going on and there's something going on with the tongue, whether that's tongue tie or something else. But
That would be
there's
great.
definitely, so there's definitely things like shallow latch, slipping off the nipple of the breast or the bottle, short, frequent feed, falling asleep during feeds. Like, okay, fine. I know like feeding to sleep is definitely a thing. I did that with both my kids. But when your kids are like falling asleep shortly after the feed starts, often it's because they're just so exhausted. They're working so hard, try to get that milk out, and they fall asleep as a result. Also, a big red flag is if they feed better when they're asleep or half asleep. That's another piece that I'm always kind of asking families about. Any of that clicking, milk dribbling out the sides, but also reflux, that like excessive gassiness, or those babies that have the hard bellies. That means that there's more air in there. There's also like, obviously, if mom is having some difficulties in terms of like nipple pain or like the blisters, and that means that baby is often chomping or clamping instead of sucking properly. Then we also have, like I mentioned, that open mouth posture, right? Sleeping, when they're sleeping, if their mouth is open, but also if they're just kind of awake and rest. So like they're just like not babbling or eating or crying or anything like that, if they're just kind of hanging out, that mouth should be closed. But even things like snoring, noisy breathing, those are all kind of little red flags that you're like, something's going on with the tongue potentially, because we shouldn't really be noisy breathers. Everybody thinks it's so cute when babies are snoring, and you're like,
Right.
but actually it's not. Yes, I know it's cute, but if you only knew that actually means there might be something more going on. But even like frequent night wakings, sometimes that's because they're not getting a full belly, or because they have the gassiness, or because they have the reflux. All of those are symptoms of something, mean that there's tongue dysfunction going on, right? And then like gagging or choking on milk, or eventually when they start solids, if we're getting a lot of that consistently, or they're not progressing in their solids kind of ladder, I guess, from like purees to more solid food and chunks and all of that, if they're having difficulty progressing, then that could be a sign that there's something going on with the tongue as well. And then of course, later on, there's like that delayed speech or difficulty with certain sounds. If your baby has a high or narrow palate, that's going to be an indicator that the tongue is not getting up to the palate the way it needs to be. Can later on lead to things like dental and orthodontic issues, right? This is why lots of people probably have their braces, because we just are running out of room in our mouths. Why are we running out of room in our mouths? Because the tongue is not doing what it's supposed to be doing. And also because our diet has changed a lot. But there's lots of different things. So those are some of like the main ones. There's so many more, but those are some of the main ones that I really make sure to ask families that I'm working with, because I like to just know the big picture. Just like I asked about their birth and their pregnancy and all of this stuff, like I really want to understand what is going on with this baby and with this family.
Right, that makes sense. And then for babies who prefer to feed on one side,
yeah,
then
exactly.
That would also be something to look out for.
Exactly. And that's also telling me that there's some body tightness going on, right? Because why do they have that preference for one side? Often also if they have the head turning preference, and then they have that preference for feeding on one side, right? And a lot of times moms are like, oh, well, I have more milk on this side than that side. But you're like, okay, but why? Like, it's interesting, right? Like if your baby is not using their tongue properly, then yeah, your body is going to start thinking, oh, well, I don't really need to be producing more milk, right? That's another piece, is a lot of times moms will think it's something to do with their supply, but it's actually their baby who is not efficiently sucking and extracting that milk. Like, talk about why like that happening. For centuries, we've been doing this, right? And so it's like, we need to kind of, evolution has figured out, how do we make this all work? And when it's not working, we really need to get curious.
Exactly. And find the root cause and not the quick fix, like a tongue tie.
And maybe you are like doing a quick fix initially, right? Like, for example, babies with reflux. Sometimes the reflux medication is really helpful and is needed. However, that should not be the end of the story. That should be like, let's put your baby on this medication so that they're not in so much pain and discomfort while we're trying to figure out what is causing the reflux.
True. Excellent point. So we are running out of time. I would love for you to share a little bit more of your wisdom. Any final tip for our listeners?
I mean, realistically, my like one tip always for families is to trust your instinct. If something isn't feeling right, whether it's like feeding struggles, or you've got sleep issues, or you think your baby has some tension in their body, it's worth exploring that. And it's worth finding or looking for a provider who really understands the whole picture and understands function and all of that. So that's like a big piece that I kind of want people to take away from. But I also want people to understand that it's not just about whether it's a tongue tie or not. Like, really get your finger in your baby's mouth and see what that tongue is doing. Do they suck on your finger? If they can't even figure out how to suck on your finger, guess what? They're not sucking on the nipple or of the breast or the bottle. Right? They're not extracting the milk well. Why can't they suck? That's what then you need to go figure out.
That makes perfect sense. And so, as far as how to work with you directly, you mentioned before that you're in Canada, but you also offer other ways to work with you.
Oh, I have lots.
Yes.
But I'll just tell you, so my website is www.kailiets.com. So that's a great place to start. You can also follow me on Instagram at The Holistic Baby Guru. I also have my podcast, Mothering from Within. I'm on YouTube. Both of those places are going to be talking all about baby development and sleep and kind of like holistic, kind of looking at the root cause of things. And then I also wrote a book called Mothering from Within, and it dives deep into all these things as well. So there's lots of opportunities. I do offer virtual international sessions as well if you really want to kind of pick my brain a little bit more about your specific situation. Yeah, but all these other, like, lots of free, lots of really cost-effective ways to get my wisdom.
Beautiful. And how can our listeners find your book?
So that's all on my website, but it's also available through like Amazon is probably the easiest. You could go to your online bookstore like Barnes and Noble, or if you're in Canada, then like the Chapters Indigo, but Amazon is usually the easiest. Unless you want a signed copy, then you can order through me.
Love it. And well, thank you so much, Kaili. We'll have to have you on to address another topic in the future.
Totally. I love talking all about babies and toddlers and all the things.
You are amazing. Take care.
Thank you so much for having me today.
Thanks for listening to Ask the Doulas. For more information about Gold Coast Doulas, visit us on our website, goldcoastdoulas.com. We're also on Instagram, Facebook, and YouTube. If you like this podcast, please subscribe and give us a 5-star review. Thank you. Remember, these moments are golden.